Hello, I'm Joo Teoh, an obstetrician, gynecologist, and fertility specialist in Perth. In this video, I'm going to talk about the common questions I'm asked as an obstetrician. In fact, I've written an article on these topics in Perth Mums group. Let's go straight in. Question number 1. When can I fly during my pregnancy? Flying is not harmful to mums or their babies in most pregnancies. However, most airlines do not allow pregnant women to fly after 37 weeks. This is because a woman at that stage of pregnancy may go into labor during the flight. Some airlines even impose restrictions on earlier stages in pregnancies based on this reason. Air travel during pregnancy, especially on long-haul flights, does increase the chance of a blood clot in the legs or pelvis, also called deep vein thrombosis or DVT. You should take measures to reduce the risk of a DVT by drinking plenty of water, choosing an aisle seat if possible, as well as standing up and do light exercises during the flight by moving your legs. Please also check that you have adequate travel insurance during your travel. Question number 2. How much alcohol can I drink during pregnancy? In short, no safe amount, no safe time, and no safe type. No amount of alcohol is proven to be safe in pregnancy, and scientific research has clearly shown that alcohol causes problems in pregnancies affecting the mom and babies. If you're not ready to announce that you are pregnant, you can always use other excuses. For example, I'm having an alcohol-free period to reset my body. For women trying for a baby, alcohol is also known to affect fertility and may reduce the chance of natural conception. Let's move on to question number 3. How many baby movements do I need to feel? Most women first become aware of their baby's movements at about 18 to 20 weeks, or even slightly later, especially in their first pregnancy. The number of movements tends to increase until 32 weeks of pregnancy. After that time, the number stays mostly the same, but the type of movement may change as the pregnancy advances. As we know, baby is getting bigger and they have less space to have big kicks or punch, so they may have to shuffle around, but they still need to move every so often, quite frequently, in fact. If you're unsure about your baby's movement, try lying down on the left side or sitting down and focus on the movements. As a very rough general guide, usually there should be at least about 10 movements over a 2-hour period. Now, the last question I'm commonly asked would be, how much exercise should I do in pregnancy? Exercise is recommended for most pregnancies, apart from some conditions in pregnancies, for example, if there's a risk of a preterm labor or very low-lying placenta. Certain activities are to be avoided. For example, you should avoid lying on the back in late pregnancies, avoid contact sports, or other higher risk activities like mountain climbing, scuba, or skydiving. I don't think roller coaster is a good idea as well. Other intensive or competitive fast-paced training is also not recommended. Now, what activities are beneficial? Generally, they include brisk walking, modified yoga, pilates, light jogging would be okay early in pregnancy, I think. Stationary cycling is better if you opt for cycling, because in late pregnancy you may be more prone to fall due to the size and weight of the belly, and also we have a reduced range of movement. It is recommended that pregnant women get at least about 150 minutes of moderate intensity aerobic activity in every week. I would advise pregnant women to drink plenty of water and avoid overheating during these exercising sessions. All right, that's it for this time. Thank you.